Technology is advancing in nearly every aspect of our lives, and medicine, well, it's no different. And some of those advancements are making enhancing your body just a little bit easier. And today, Dr. James Nachbar is here to talk about a new procedure for breast augmentation. Welcome to the show. It's good to see you.
Good to see you.
I know a lot of people have a lot of preconceived ideas about breast augmentation, and I think this is a great way for us to kind of put it all out there, starting first with what the difference is between saline and silicone implants.
Well, Stephanie, I brought two kinds of implants so you can see the difference for yourself. This is the silicone implant. It's much softer. It's filled with the silicone gel material. This is the saline implant, which is basically saline is another name for salt water. So you can see it has these corners and wrinkles on it. One nice thing about the saline implant is we can put it in empty. We basically empty the saline out, put it in through a small little opening. The silicone implant is a semi-solid material. It's not really liquid, and so it does require us to put it in through a little larger opening. So one of the things we're going to show you today is that we have a new tool to be able to put this into a smaller opening than we've been able to.
Most people use the silicone.
I would say these days, since the silicone implants were approved in 2006, 75% of my patients use the silicone.
But in doing so, if they're not going to doctors that really specialize in what we're going to discuss right now, they're encountering a greater opening to get it in.
Right. So that's true. The funnel we've got here lets us put it into a smaller opening.
Bag, really.
It's just like a pastry bag, works just like a pastry bag as well. And in fact, we have some videos so you can see how that works.
Okay, so we're going to see how this is in action, and then I'll show you that you actually have your measurements right here.
Right, so different implants require different openings. So here you can see that we, I'm sorry, so this is the funnel. You can see a little pastry bag here. We've got the measurements here so we can make it a different length here. This video shows the implant going in through the
look at
funnel.
that. Okay, so if that, basically the diameter at the bottom is where it would be applied to the breast, and that's how it's going to go in, correct?
Right, so we can make a smaller opening, and so there's the silicone implant. It goes inside the little pastry bag, and then we just squeeze it in through a little opening.
Look at that.
Isn't that cool?
Okay, so it begs the question, it seems like there has to be just the perfect amount of pressure to be able to do this type of procedure. I would imagine you can't do it too hard, not too soft.
That's exactly right. And these implants, because it's a semi-solid material, you don't want to put too much pressure on that. So that allows us to, if you make an opening that's too small and just try to push it in, you're going to wind up pushing it too hard. You can shear the bag from the internal part of the implant. The funnel provides smooth, even pressure around the whole implant, and that way we can use the funnel to put it in and provide much smoother and softer pressure to the whole implant as it goes in.
That's fascinating to me that you can use something like this, put that, and then have a smaller opening that you have to go through. What a great benefit to women.
Smaller scar, definitely a big advantage.
Now, is there less downtime because the opening is smaller?
Truly, there's not that much downtime with the surgery either way, and I don't know that it's really less downtime because the incision's smaller. But the big advantage is the scar is smaller, and people like to have a smaller scar.
I haven't heard. I've done this show for, I don't know, 5 years. I've never heard about this before. Is this fairly new?
It's a pretty new procedure, and we're just sort of starting to learn how to use it. It does require a little bit of specialized training, and I don't think there are that many doctors doing it, although more hopefully will start doing it.
Well, I'm glad that we found one that actually does, because this is something that people are going to want to know about if they're going to this, because the FDA says this is safe, this is fine, and this is appropriate, and then they have less scarring. Why wouldn't you?
Big advantage.
Why
yes.
wouldn't you? Absolutely a big advantage. Any last thoughts for people as they are starting to consider what type of breast augmentation is going to be best for them?
Well, the best thing to do is to talk to a board-certified plastic surgeon certified by the American Board of Plastic Surgery. Take your time, do your research, learn the different ways of doing things, and make your decision.
Fantastic. I'm glad that we know about this. I'm going to go tell my girlfriends that are all looking into this and let them know that that's out there. It's fascinating. Now, if you would like to speak one-on-one with Dr. Nachbar, you can get a hold of him at Scottsdale Plastic Surgery. His office is located at 8896 East Becker Lane, Suite 102 in Scottsdale. The phone number is 480-289-5300, or perhaps you should just visit his website as well. That is at plastic.org. Plastic.org. All that information, of course, on our website as well.